Welcome. Thank you for choosing Catholic Medical Center for your upcoming cardiac procedure. We have produced this short video to help you better understand what to expect before, during, and after your procedure. After viewing this video, you will be contacted by one of our cardiac teaching nurses who will be glad to answer any questions you might have. We will start by briefly reviewing the structure and function of the heart and common indications for transcatheter aortic valve replacement, or TAVR. The heart is a hollow muscular organ which beats approximately 100,000 times per day. The right side of the heart receives unoxygenated blood from the body and pumps it to the lungs, where the blood receives fresh oxygen and is rid of its waste gases. The blood is then returned to the left side of the heart, and the left heart pumps it to the entire body. The right and left sides pump simultaneously. The flow of the blood is regulated by the opening and closing of 4 heart valves. The tricuspid valve separates the upper and lower chambers of the right side of the heart, while the pulmonic valves regulate the flow of blood out to the lungs. The mitral valve separates the upper and lower chambers of the left side of the heart, while the aortic valve regulates blood flow out of the heart to the entire body. Heart valves operate like one-way gates. They open to allow blood flow through your heart and out to your body. They close to stop blood from flowing back into the heart after it has been expelled. The valves permit blood to flow in one direction or pathway through your heart. The leaflets of a stenotic or calcified aortic valve are unable to open wide. Valves that are stenosed or stiff will restrict blood flow through the heart. Regurgitation occurs when a leaky or loose valve allows blood to flow back into the heart instead of out to the body. When these conditions start to produce symptoms or affect the function or structure of the heart, the valves will need to be repaired or replaced. Some patients may be high risk or too sick to undergo open heart surgery or minimally invasive open heart surgery. Another treatment is called transcatheter aortic valve replacement, or TAVR. TAVR is a procedure that inserts a new valve inside your diseased aortic valve and does not require your chest to be opened. This procedure is intended for patients with age-related aortic stenosis. The most common symptoms of valve disease are tiredness and shortness of breath. Other symptoms are swelling in the legs or extremities, chest discomfort, changes in heart rhythm, lightheadedness, fainting spells, and a cough. Some people experience some or all of these symptoms. Some people do not have any at all, but have their heart disease discovered through a routine physical exam. Most, however, have had some sort of problem that has led to the discovery of their heart valve disease and the need for a valve procedure. Your doctor will discuss the type of procedure that is needed. During the TAVR procedure, the doctor inserts a new valve inside your damaged aortic valve. The TAVR valve is made of bovine or porcine tissue that is stitched inside an expandable metal frame. Your doctor will decide the best type of TAVR valve for you. There are several different approaches or access options for the TAVR procedure. The arteries in your body are like a system of roads. They branch out from the heart. There are different routes that your doctor can use to get to your heart. These include an artery in your leg, an artery in your neck, a space between your ribs, and another entry point determined by your doctor. Currently, the most common route is through the artery in your leg. This is called the transfemoral approach. If the transfemoral approach is used, your doctor will insert a short hollow tube called a sheath in the artery in your leg. A balloon is then put through the tube and guided up to your aortic valve. The balloon will be inflated to break open your narrowed valve, deflated, and then removed. The transcatheter heart valve will then be placed through the sheath and guided up by a type of X-ray up to your aortic valve. The balloon will be inflated, expanding this new valve within your damaged valve. During the expansion of the new valve, the heartbeat is temporarily increased. To do this, your doctor will place a temporary pacemaking wire in your heart, which causes your heart to race. Again, your doctor will discuss this with you, which access site is best for you. Prior to your procedure, you will have several tests done to evaluate your overall health. The doctors and nurses caring for you will ask you for your complete medical history. You will have various labs and radiology tests, as well as an EKG, a cardiac catheterization, dental clearance, a chest x-ray, a urine test, a CAT scan, and a transesophageal or transthoracic echocardiogram. These are all routine preoperative tests to know as much about your medical condition as possible. We ask that you take nothing by mouth after midnight except for medications as instructed with a small sip of water. Please leave your jewelry and valuables at home to prevent their loss while in the hospital. Please remove all rings since post-operative swelling is common, and any rings will restrict circulation if left in place. The morning of your procedure, you will be shaved in several areas by a technician. This is to help prevent infection after your procedure, and also will aid in the comfort of dressings and tape on your skin. You may receive a preoperative medication to help you relax before you leave the nursing floor. Most people are nervous prior to surgery, and this is helpful. Once in the procedure room, an anesthesiologist will give you medication that will cause you to go to sleep or relax. While you are having your procedure, a staff nurse will direct your family where to wait. After the procedure, your doctor will decide if you should recover in the intensive care unit, ICU, or the PACU, post-anesthesia care unit, before returning to the heart and vascular unit on D200. If the family is directed to the ICU, we ask that your family contact the staff in the ICU by using the intercom in the hallway to give the staff a family member's cell phone number so that they may be contacted when the providers are ready to talk to the family. Please discuss the length of the procedure with your provider. As you start to wake up, you will become aware of the various monitoring lines and drainage tubes that may have been placed after you went to sleep. One of the monitoring lines will be in an artery in your wrist and will monitor your blood pressure continuously. These special lines and tubes are placed while you are asleep. You will become aware of them once you wake up and will have pain medication provided through an intravenous line for your comfort. Your groin wounds will be monitored frequently. You may have a catheter in your bladder. Your heart will continue to be monitored. You will be encouraged to do some foot and leg exercises, and your activity will be increased as tolerated. When you are medically stable, you will be transferred back to your room on D200. Prior to your discharge home, you and your family will receive discharge instructions from a staff nurse. They will review normal and abnormal healing, activity guidelines, and how and when to call the doctor. You will be provided with a booklet with all of your discharge information. There will be a home walking program included in your booklet. The physical therapy department may or may not review this with you. Walking is the best exercise in the early recovery period and will help you to slowly regain your strength and endurance. You may meet with a registered dietitian who will review a heart-healthy diet with you before you go home. Many people are not very hungry, and food does not taste good to them. The dietitian can help you find the right foods for proper healing. Depending on your medical condition, you may receive instructions from other healthcare providers prior to your discharge. For patients who have had a valve procedure, you must take extra precautions against infection. When bacteria gets into your system, it can settle on your valve and affect its function. Tell all healthcare providers about your valve procedure to ensure you receive appropriate antibiotic treatment before any procedures, including dental work, invasive exams, minor and major surgery. In addition, clean all cuts and abrasions thoroughly and apply antiseptic ointment. If you suspect any type of infection, including lingering colds or flu, urinary tract infection, vaginal infections, please contact your doctor for treatment. Depending on your type of valve, you may require anticoagulation therapy to prevent clots from forming around your valve. If you do, You should receive more information from the nurse on the floor that is taking care of you. If you will require an MRI in the future, please inform your provider and the MRI staff about your valve procedure. After you are medically cleared by your physician, you are strongly encouraged to participate in cardiac rehabilitation. Cardiac rehab is a monitored exercise and education program that is structured to help you maximize your recovery from your valve procedure and prevent further problems. We will provide you with a list of regional programs available to discuss with your cardiologist or primary care provider. Thank you, and we hope this brief video has been helpful and that you have a healthy and happy recovery.